Good morning. My name is Sonya Tetnowski, a Makah tribal member, and I currently serve as the president-elect of the National Council of Urban Indian Health, which represents 41 urban Indian health care organizations across the nation who provide high-quality, culturally competent care. I'm also the CEO of the Indian Health Center of Santa Clara Valley, a UIO that provides comprehensive health care to over 22,000 patients. Let me start by saying thank you to Chairwoman Pingree, Ranking Member Joyce, and members of the subcommittee for the opportunity to testify today. I testify today to request the tribal work group's recommended amounts of $50 billion for IHS and $950 million for urban Indian health for fiscal year 2023, supporting the president's proposal for mandatory funding for IHS, as well as advanced appropriations for IHS. We also ask that UIOs are protected from unrelated budgetary disputes and have access to the available opioid funding. UIOs provide a range of services and are primarily funded by a single line item in the annual Indian health budget, which is only 1% of the annual budget for fiscal year 2022 for the over 70% Native people living in urban areas. Despite historically low levels of funding, UIOs have continuously provided services in the hardest hit urban areas throughout this health crisis. In fact, the county where my UIO is located was the first in the country to initiate shelter-in-place measures, as we were considered a hotspot by the CDC. I'm proud to say that IHC-SCV has been fighting diligently from day one of this pandemic to do whatever it could to protect the community. Our UIOs have played a critical role in Natives having some of the highest vaccination rates in the U.S. However, in order to match the pace of other clinics, we need a consistent baseline of funding, as costs for providing care continues to increase with the growing shortage of healthcare providers. As Native people had some of the highest infection rates, increased funding is needed to address the long-term impacts that COVID has had on our members. I share these insights to highlight the need for continued increases in Indian health funding and stress the importance of honoring the trust responsibility. Federal trust obligation to provide health care to Natives is not optional and must be provided no matter where they reside. Continuing to fund IHS at its current pace is what has led to irreparable health disparities, which is why we are fighting for full funding. Funding for Indian health must be significantly increased if the federal government is to finally and faithfully fulfill its trust responsibility. We want to thank the committee for the report language to allow us to finally use our 1% line item for facilities. Your report was instrumental in its final inclusion in the bipartisan infrastructure package. However, because UIOs do not receive designated facilities funding, unlike the rest of the IHS system, it is critical that the committee increase the funding for the urban Indian health line item. Additionally, any authorizing language that is specified for tribal organizations does not include urban Indian organizations. So we ask that the urban Indian organization be included in all future legislation so that we can work together to close the health equity gap that exists today. We urge you to please reach out to IHS and NCUI to ensure funding designated to help Native communities has the proper language to ensure we are included. Another priority is advanced appropriations, which for IHS is a long overdue request from tribal and urban leaders alike. Advanced appropriations is imperative to provide certainty to the Indian healthcare delivery system until such time that all trust and treaty obligations to all AIAN are accounted for and provided as mandatory spending. Again, the risk is too great and the price is too high to continue funding the way that it is now. I urge the subcommittee to consider these requests and prioritize urban Indian health, thereby enabling UIOs to continue providing high quality, culturally competent care to Native people, regardless of where they live. Thank you for the opportunity to speak today. I have provided written testimony to the committee and I'm happy to answer any questions.